Hi, my name is Dr. Raymond Benedetto, and I want to thank you for taking a few minutes today to watch this video. We're going to be going over a lot of things today in a relatively short period of time. So I hope this information is valuable to you. I'm sure you're watching this because either you or a loved one are suffering from migraine headaches, chronic headaches, which is what we're going to talk about today. So go ahead and grab a piece of paper and a pen. We're going to go again through a lot of things in a relatively short period of time. So if you have any questions, I'm going to give you our contact information at the end of this video, this presentation, so you can get in touch with us by email or phone or what have you. So again, thanks for taking the time. Some of you are watching this on video, some on the internet, some on YouTube. Either way, let's go ahead and dive right in. Take some good notes if you need to, and again, I'll give you our contact information if you have any questions at the end. So what we're going to be talking about today, the metabolic treatment and brain-based therapy for the treatment of migraines and chronic headaches. Who am I again? Dr. Raymond Benedetto. I've been practicing. I'm a doctor of chiropractic. I've been practicing for over 10 years here in Bethlehem, Pennsylvania. Seen hundreds and hundreds of migraine patients and headache patients, probably like yourself. I am a board-certified chiropractic neurologist, so I have a lot of training in treating these neurological conditions, and again, we've seen hundreds of them over the years. Charter member of the International Association of Functional Neurology and Rehabilitation, and again, I've studied under and I'm close friends with Dr. Michael Johnson, Dr. Michael L. Johnson, who's up in Wisconsin. He's the author of the book, What Do You Do When the Medications Don't Work? So non-drug treatment for chronic conditions, migraine headaches being one of them. Big picture-wise, let's talk about chronic health conditions in general. Okay, they all have some common threads, whether it be migraines or what have you. Obviously right at the top there. Things like thyroid conditions, fibromyalgia, peripheral neuropathy, stenosis, autoimmune disease. Okay, there are some common threads with all these conditions. Okay, and there's horses of a different color, but there are two big primary causes to these conditions. We have metabolic imbalances, things like anemias, thyroid dysfunctions, autoimmune disease, food sensitivities, and we have neurological imbalances. Obviously with migraine headaches we have neurological issues where parts of the brain aren't working right. Now for these different conditions, it could be any different combination of those things, but we have to look at these to help patients. So all cases, migraine or no exception, are a combination of neurological problems and metabolic problems. In order to help patients like yourself, we got to figure out what those are for you. It's different for everybody. Question for you. Okay, so our metabolism, we eat food, it gets converted into energy for our body to use. 30% of that energy, so a good chunk of it, goes to what system? Endocrine, digestive, nervous system, immune system, or the cardiovascular system? Answer is our nervous system. Okay? Our brain, our spinal cord, our nerves. 30% of the energy that we take in goes to our nervous system. So we need to have proper metabolism in order for our brain to be working right. Okay? So that we're not getting migraine headaches or we're not getting chronic headaches all the time. Now, body-brain connection, okay? Your brain is a sensory organ, okay? It takes in all this information from all around us all day in our world and in our body, and it needs to process all that information, not unlike a computer, okay? So your brain has to be responsible for everything, okay? Where are your muscles, your skin, your eyes, sound, everything that comes into our brain. Now, what are the two sensations that stimulate the brain the most? Okay, answer is gravity, which if you think about it is pulling down on us constantly, right? So gravity is always acting on our bodies. And touch, like our brain, touch fires up our brain, any kind of touch that we receive. Now, real quick, let's do some anatomy because this is going to tie in obviously to migraine headaches. 3 parts to our brain, 3 main parts, okay? Number 1 is called the cerebellum. It's in the back of our brain. It's responsible for coordination of movement and eye movements and postural muscles, things like that. Okay? We have what most patients think of as the brain, what most people think of as the brain, the cerebrum, which does a lot of our obviously complicated functions, language and thought and emotion and things like that. And we have what's known as the brainstem, which controls a lot of our what are called autonomic functions in our bodies. When I say autonomic, I tell people think automatic. All the things that happen in your body that you don't need to think about. Your pulse rate, your heart rate, your digestion, your respiration, your breathing, your blood vessels, the size of your blood vessels, which again, this area plays a large role with migraine headaches, so it makes sense. So the cerebellum, the brain, or the cerebrum, and the brainstem. Now, here's how the brain works. Okay, we get sensory input to our body from our world and from our body, and all that information goes to the cerebellum first, which is at the bottom there. Okay, on the same side. So anything that happens on the left side of our body goes to our left cerebellum. That information is then sent up to the brain to be processed. Okay, but what happens is it crosses over. So the left cerebellum talks to the right brain. Again, the upper brain stem, the brain has also big connections to the brain stem. These things are all connected. I'm trying to keep it simple. So the brain stem is a major area of what's called our sympathetic nervous system. That's our fight or flight response. And our brain helps to regulate it, helps to control it. If our brain's not doing that right, we can get overfiring in that part of the brain, which is a big part of headaches, migraines especially. Any chronic condition, but migraine specifically, obviously what we're talking about today. So that cerebellum fires up to the brain, and the brain fires down to control the brainstem. Now, again, if this part of our brainstem specifically is overfiring because the brain's not regulating him, we'll get a lot of different things. We can get a lot of different chronic conditions. Chronic pain, chronic fatigue, irritable bowel syndrome, urinary tract infections, migraine headaches, obviously, posture, bad posture, overstimulation of our adrenal glands. These are all things that we have to look at with patients. Blurred vision, sweating, difficulty falling asleep or staying asleep, sensitivity to light and sound, which I know migraine patients obviously is very common, that aura that patients get before a headache. What if our cerebellum's not working right? We'll get things like dizziness and vertigo, which again, a lot of patients have with headaches. Chronic neck and back pain, disorganized thinking, clumsiness, lack of coordination. Again, cerebellum, brain, brainstem. Now, what if the upper part of our brain isn't working so well? Our frontal lobes, our parietal lobes, the different parts of our brain. Those parts of our brain won't be regulating that brainstem. So we'll see some of those symptoms. But we'll also see things that you would associate with my brain's not working so well. Depression, anxiety, difficulty reading. My eye movements, I can't comprehend what I'm reading. I have to read the same paragraph 10 times for it to sink in. Difficulty with expressing myself, difficulty with memory, learning difficulties. I can't concentrate, things like that. Now again, sensations, right? All the sensations that in our body go to our brain for processing. So we might get numbness, tingling. Again, auras when we're talking about headaches. Changes in handwriting, increased irritability, lack of motivation, learning disabilities, social disorders, ADHD, these conditions that are on the rise significantly. So, how do we get some of these things? So this part of my brainstem is not working so well. How does this give me the symptoms that I get with migraine headaches, or headaches in general, really? Okay, so this upper part of our brain is not regulating the brainstem. Okay, so we get overfiring in that part of the brain. The nerve that controls our pupils lives in that part of the brain. So that nerve's not doing its job properly now. So the pupil actually gets bigger than it should be. More light comes in, we get sensitive to that light. Okay. Again, a big problem with migraine headaches in general. Okay, same thing. So we get overfiring in that part of the brainstem, which is, now this is from an endocrine side of things. So now we're going to talk about hormones and the adrenal glands and things, how they contribute to this. We get firing down the spinal cord to our adrenal glands. They sit on top of our kidneys. They're our stress glands. They release cortisol and things called catecholamines, which are inflammatory chemicals. They stimulate our pain fibers, the pain sensory fibers in our body, which can trigger a migraine. Now I got fatigue because I can't sleep. Okay? So, same thing. We're talking about sleep difficulties now. Again, it can be a problem, especially with fatigue, with headaches. Same thing. That part of the brain overfires. Okay? What it can do is it can reverse our rhythms. So we're obviously supposed to be asleep at nighttime and awake in the daytime. So we're supposed to be at our highest functioning during the day, middle of the day, and our lowest functioning at nighttime. Well, this gets reversed. So now we have our brain's firing at its highest rate at 3 a.m. when I can't fall asleep, or if I wake up, I can't get back to sleep. And our lowest at 3 p.m. So I'm tired. I got that, 2:30 fatigue, that 3 o'clock fatigue. I'm just wiped out. Now, again, when we're talking about migraines, we get an overfiring in this part of the brainstem. What it does is it causes the blood vessels, especially in our brain, to rapidly dilate and or constrict, okay? Which causes the nerves that surround those blood vessels to get very irritated, a lot of pain. Can trigger migraines. How does all this happen? Different stresses to the brain that causes the fatigue. Chemical stress, physical stress, emotional stress, anything that stresses the brain, okay? We'll talk about some chemical stresses, physical stresses to the brain. Anemia. Okay, having anemia, that can trigger headaches. Blood sugar imbalance, for sure. Even if you don't get headaches a lot, your blood sugar gets low, you haven't eaten, you know, it gives you a headache. Food sensitivities. I have a sensitivity to a food. Immune system problems. Your diet stinks. Drugs, prescription drugs. Headache patients, if you're one of them too, you know things about rebound headaches and stuff like that. Chronic inflammation. These are all metabolic problems that can cause the dysfunction in the brain that's causing the migraines or causing the headaches. Adrenal gland disorders, right? So our adrenal glands are being overstimulated, a lot of cortisol in the bloodstream, high blood sugar, low blood sugar, those kind of things. They're going to cause degeneration in your brain. Again, more metabolic disorders. We talked about some of these. How do you know if you have any of these? How do I know if I have a food sensitivity? Or how do I know if I have an anemia or an adrenal gland problem? You have to be tested. Okay? We do this on all of our patients, and most likely you haven't had it done because you go to the doc and it's like, I got these headaches, and they sound like migraines to the doctor, so okay, try this triptan or whatever the newest drug is. Nobody's tested you to get to the bottom of what's causing the problem. Okay, so we got to do proper tests, lab values, blood work, things like that. The problem is even if patients do get those done, they're told, you're normal, and we don't see anything here that's causing your headaches. The problem is we're using lab values. So you've seen your blood work and you see the ranges, and they're huge. And all my numbers are right in the middle of those ranges. The problem is those ranges are inaccurate. Okay, we need to tighten things down a little bit and use these functional lab values because they're going to be more sensitive to picking up on things. So here's what your lab tests look like, but they're normal, but you still have a problem. You're still sick. You're still getting headaches. Okay, this is healthy people, right? In this nice functional range. Abnormally low, abnormally high. Your doc's probably not going to do anything until you get into those ranges, which are way out here. We want to pick up on things that are in here and that are in this green area here. These are these, kind of in between those functional values and the abnormal high or low, where your doc's going to say it's normal, but it's not. And that's contributing to your problem. And you may stay in that range forever, and nobody ever picks up on it. Okay? For instance, we'll take like a blood sugar, glucose. We want to see a nice functional range between 85 and 100. Well, the lab value says between 65 and 110 is normal. Okay, you're not diabetic till you're 126. Well, say you're 73. We're looking at some hypoglycemia there, some blood sugar issues that could be triggering migraines, among other things, where it's going to show up normal on a traditional test. Okay, we see these with all this stuff, cholesterol and TSH and all these different values that we see on patients with their blood. Now, so based on your history, so based on a patient's, look, here's what my life's been like, here's what my headaches have been like, we may run a variety of tests depending on that particular patient. Blood analysis, okay, we talked about that. Hormone testing, they'll look at hormones a lot of times with saliva. Stool testing, we need to look at gut function and food sensitivities and things like that. We do things like Cyrex lab testing, so we look for autoimmune disease. Is my immune system attacking my brain that's causing some of these headaches or some of these migraines? Pretty common, actually. Now, what we do here in our office is called brain-based therapy. How is it different? What is it? How do we fix people's brains? How do we get their migraines to stop by doing these therapies? We call it BBT for short, brain-based therapy. What it is, it's finding the areas of your brain that are weak, that aren't working right. They're understimulated. We talked about those three main parts before. What is it for you that's not working right? And correcting them. Get them working again. Come up with therapies that are going to get them working better. Your brain needs two things to work right. It needs fuel and it needs activation. So it needs fuel. We need energy, glucose, sugar. It needs oxygen. Okay, again, a lot of times with especially migraine patients, that aura is some rapid oxygen deprivation to the brain because of the blood vessels. Activation, we need stimulation to the brain. Okay? Oxygen is huge for brain activity. And as we age, we don't use oxygen as well as we used to. The brain uses a lot of oxygen. If you're not getting proper oxygen to the brain, it could be triggering your headache. We're talking 20 to 30% of our oxygen that we breathe goes to our brain. Okay? Some studies with headache and oxygen. Pretty good study, 109 people. 78% of them that got oxygen reported relief within 15 minutes of the treatment. 78%, 15 minutes, compared to 20% who didn't get oxygen. What are the benefits of oxygen therapy? Now, we use this with our patients in the office, oxygen therapy with these other treatments. Stimulates brain activity, boosts concentration, builds endurance, reduces stress, detoxify your blood, things like that. Important stuff. So we use oxygen with different therapies to stimulate brain activation, to stimulate. So we use oxygen concentrators. We don't use tanks. You don't need prescriptions or anything. We do them while we're doing our rehabilitation therapies here in the office. What are some of the therapies we use? Again, oxygen therapy. We may use vibration. We may use different types of stimulation to the joints, the spinal joints. We may do eye exercises. We may have you doing smell therapy, different kinds of stuff. Again, based on the particular patient and your findings. We may use visual stimulation, stimulation through light and sound. We use different kinds of glasses and eye exercises and all kinds of puzzles and things like that. Again, depends on the patient, what we're trying to do. Things like something called an interactive metronome, something called eye lights. We use all different kinds of stuff to help stimulate the parts of the brain that are weak. So, what's the solution to migraine headaches and chronic headaches? Proper metabolic testing. You need to be tested to see if there's any of those underlying causes metabolically. And then what we find, we fix through supplementation, dietary changes, those kind of things. Okay? Proper exam, thorough exam to find these brain imbalances. And then based on that, we use these therapies, this brain-based therapy with oxygen to help fix them. You take all these pieces of the puzzle, the metabolic side of things and the neurological side of things, we need to put them together. Okay? We got to figure out why the brain's not working right, and we got to fix it. Okay? So we can put you back together again and get all these things on the same page. So what's next? If you're interested, you can come in to see us. We'll see if we can help. Okay? We offer 2 visits. Okay? It's broken down. The first visit, complete case history. You'll come see us. You'll sit down with me. We'll go over everything that's going on with your health and with your life, really, to figure out what could be causing this problem and are we going to be able to help fix it. We'll review your previous testing or labs. We'll fill out different assessment forms. Spouse or significant other should be with you, if possible. Because we're all on the same team here. We're all pulling the same rope. Number 2, visit 2. So if I think we can help you after we see you, visit 2. I'll be able to review everything. I'll be able to let you know, okay, we can accept your case. Here's what we got to do. Here's the testing we need to do. Here's exams we need to do. Here's treatments we're going to be doing. Any financial obligations, things like that. Again, spouse or significant other should be here. Now, what we do, here's the offer. Okay? Here's what you can do if you want. We only take a handful of patients every month, migraine headache patients. We're talking a handful, 5. Usually I would charge, if somebody hasn't watched this video or they don't know us, they haven't been referred in, $450. If you want to make an appointment after watching this, it's going to be complimentary. Okay? We can sit down and figure out if we can help at no charge. Okay? 3 rules we have to see if we can accept your case. You have to be willing to make some changes. Okay? There's probably going to be changes that need to be made, whether it be through diet, supplementation, treatment. Okay? You have to take accountability for your health. I can't fix your migraines and your headaches all by yourself. We have to do it together. You have to take responsibility. And there's a chance that your insurance or Medicare may only pay a small portion of the things we need to do, or not at all. We have made our care plans affordable so that if patients have out-of-pocket expenses, we can make it affordable for almost all of them, even if it's for a small monthly payment. You got to think to yourself, how serious is the problem? How are these migraines, these headaches affecting my life? And am I motivated enough to get them done? I can only take a certain number of patients for treatment, so we only want the ones who are committed to getting well. I want to thank you for your time. If you'd like to get in touch with us, questions, comments, concerns, you'd like to make a consultation, BenedettoChiropractic@gmail.com. You can email. Our phone number is 610-974-9911. We'd be happy to help you out. Thanks for taking the time today. Again, if you have any questions, you can give us a holler and we'll help you out. Have a great day.